Now let me talk about what is pregnancy-induced hypertension, what is pre-eclampsia, and what is eclampsia. Now let me take you to a normal OPD routine in our Kerala health system, that is in the gynec department, where the nurse will take the BP of every antenatal woman, and usually they are surrounded by relatives who are very primed or anticipating a very happy moment. So but at the moment where the BP crosses the normal levels, we can see the tension that is arising in the person who takes the BP, and once it reaches sky high, we know that this pregnancy is not going to be normal. So what is this pregnancy induced hypertension? It is said that placenta itself is the cause for this. So once the placenta is removed, or once the termination of pregnancy occurs, the patient comes back to normal. So we know that pregnancy induced hypertension not only causes problems for the baby, but also causes for the problem for the mother as a whole. It can affect the cerebral system, that is the head, our brain, as well as the heart. It can affect our kidneys. So it can be a multi-system disorder. So that is a problem with pre-eclampsia. So we need ASHA workers, we need a mid-system level of healthcare professionals who can go door to door and see each antenatal woman and check their vitals, check their BP, so that we can adequately understand very early which all women might need more care, and detect this high BP and hypertension in these women and treat them at the right time. So that is very much required, because otherwise these women will later on develop many complications. So that is the importance of detecting hypertension earlier, and also giving adequate antenatal care at the right time. So now the word eclampsia, it is actually seizures that happen because of high BP or hypertension. So why does that occur? Again, it is because of cerebral edema and high BP, which is affecting your brain and causing seizures, and this can decrease the blood supply to the baby, and that can cause hypoxia, and it can even cause intrauterine death to the baby. That is, the baby can die in the uterus. And also the mother can have various morbidity later on, and can also lead to hemorrhage in the brain, can also cause death. So how do we manage a case of eclampsia? So usually women come with eclampsia who were not treated, or who, hypertension was not detected earlier, and they come seizing. So it is similar to any other woman or any other person that you will take care. Just same way we have to take care of the pregnant woman, that is prevent injury, stabilize their vitals, stabilize their airway, all that, and we give antihypertensives and also anti-epileptics or anti-seizure drugs. And these women usually get well with the termination of pregnancy. But if it is not detected, they can seize again and again, and if they are at home or if they're somewhere else where they're away from a specialist, they can seize again, and they can finally die because of eclampsia. Some women may have this hypertension persistently, even after the delivery, even after 6 weeks of delivery, they still have high BP. So this can be due to other causes which are underlying and undetected. So in these women, we have to refer them to maybe a cardiologist, nephrologist, and see if there is any autoimmune disorders, or if there is any underlying kidney disorders which is causing hypertension. And most of the women who are hypertensive, we discharge them with antihypertensives. And most of the time I see that these women, they take drugs, and when their BP, they see that the BP is normal, they stop on their own. That should be never done. It has to be stopped only after consulting a doctor, consulting a specialist, and you have to taper down the drugs. Otherwise, BP can increase again during the puerperium, that is after delivery, and cause seizures even after childbirth. So when we discharge these patients, we ask them to do lifestyle changes, because most of them, if they don't have good proper lifestyle change, it might later on lead to hypertension, cardiovascular diseases. So this is how we discharge them. And this is how we can prevent postpartum problems, as well as pregnancy induced hypertension complications during pregnancy.